Ever felt like a tough day at the clinic left you drained? I've been there, mate. And here's the thing, I've learned to transform these tough encounters into opportunities for growth and development. I remember my early days as a fresh, wide-eyed, just out of the box physio grad, stepping into the clinic full of difficult patients. It was crazy overwhelming. What I've come to learn is that every challenging interaction can serve as an opportunity for growth, not only for yourself, but for your patients as well. Arguers, scaredy cats, overachievers, and patients who look at you like you've got three eyes. They're all here. This video is just what you need to learn phrases and techniques that will help you cope with the most difficult patients. Bring it on, Buttercup. But when dealing with these tough patients, the goal isn't just to make it through the day. It's about turning each obstacle into an opportunity for success. Here's the key. Understand the types of patients you're working with can be a powerful tool. Let's dive into the categories of these difficult patients so you can know how to navigate the situation better. Over time, I've learned that these patients are categorized into three main types, namely, first, uncooperative behavior. This is the human equivalent of a stubborn donkey when it comes to doing exercises. They'd rather argue with you than move. Second, communication barriers. It's like playing charades in the dark, blank stares, and confused shrugs. Third, emotional barriers. These patients have more ups and downs than a roller coaster, and instead of a restraint to keep you safe in your seat, all you have is empathy. So just as weight training helps us build strength, these challenging patients help us become better physios. Here's how you can go from feeling drained and defeated to energized and effective. I have 4 strategies for building rapport with every patient. But if you've seen any of my videos, you know that there's a secret bonus section for those who make it to the end. So don't just click away when your attention starts to wander. Focus. You've got this. Remember when I told you about my early days as a fresh-faced physio? Well, between the trial and error and reading self-help books, I've learned how to tangle with the toughest cookies in town. It took me 30 years, but this is what I've learned. Section 1, my 3 proven strategies for winning over uncooperative patients. Have you ever had a patient who was totally resistant to active exercises? I get these patients all the time. What do? Through the years of clinical experience, I've distilled my approach into 3 proven strategies for engaging even the most resistant patients. These methods are tested and refined through countless patients and offer the highest likelihood of achieving positive outcomes. Nothing works for everybody, so we need to tip things in our favor. Number 1, motivational interviewing. Just the other day, I was working with another patient who was struggling to stay motivated with their exercise program. Motivational interviewing taps into the basic science of motivation. It's like asking the right question to unlock somebody's inner drive, kind of like how Archimedes found his eureka moment. By using these motivational interviewing techniques, I helped him tap into his own inner drive and identify his personal reasons for being in therapy and wanting to recover and improve. I asked questions like, what's holding you back from this stretch? What made you feel good in past treatments? What's stopping you from moving forward with this exercise? Can you tell me more about what has worked for you in the past with similar treatments? What are your biggest concerns about starting this therapy? What do you feel is limiting you with this exercise? What would make you feel more comfortable with this exercise plan? It's wild how simple questions can get patients excited about getting better. I see it like being a detective, guiding them to discover their own inner motivations and find the keys to reaching their goals. After all, Batman was the detective, and he's pretty cool. And I didn't concoct this entire video just so I could have an excuse to show up my Physio Batman picture. He's still pretty cool. 2, clearly state your expectations. Setting clear expectations from the start is vital for building a strong patient-therapist relationship. And let's be honest, you can't achieve great treatment outcomes without first establishing a connection with your patient. Ideally, you'd have strong rapport with every patient, but sometimes you have to make do with even the slightest hint of a connection. A slightest hint of a bond. I know you're frustrated. Now let's try to make things better. Let's define what we want to achieve today. Our goal for today's session is to gently increase your mobility. Does that sound good to you? Let's focus on one specific area today. What would you like to achieve? By the end of today's session, I'd like us to be able to achieve, insert specific goal here. Does that sound good to you? Here's what we're aiming for today. Let me know if you have any other different priorities. By setting clear expectations, patients feel more empowered and motivated to take an active role in their recovery. 3, establish trust. Building trust with patients who have had traumatic or negative experiences in the past can be challenging. However, by demonstrating empathy and understanding, you can start to break down these barriers and establish a foundation for a positive and supportive therapeutic alliance. Say something like, I appreciate you sharing this with me. Let's find a solution. I understand that trust takes time, so I want to assure you that we will take this at your pace. It sounds like you've had some tough experiences before. I'm here to make this different for you. Sharing your concerns helps us work together better. Thank you for trusting me with that. I realize that this may seem hard, but I'm here to support you through every step. Now, after tackling the uncooperative patient, let's dive into another common physio challenge, dealing with patients who aren't exactly jumping for joy to be in physio at all. Keep going, you're doing great. Section 2, practical tips for physios to improve patients' negative attitudes. Do you struggle with skeptical patients? I struggle with skeptical patients. Most of my patients are just in physio because their doctor wrote them a script or because they don't have chiropractic coverage. Let's be real. Some of them are thinking, why bother with exercises when I could get a quick crack from the chiropractor? But here's the thing. Chiropractors might offer quick feel-good techniques, but it's physio that offer long-term solutions. By making exercises meaningful and engaging, patients become active participants in their recovery, and that's where the magic happens. That's where function is improved, and that's why we're here. By making these exercises meaningful and functional, we turn their why bother into let's do this. Does this sound familiar to you? These are 4 strategies that worked for me, so let's crack on. Build rapport with empathy and humor. I start by acknowledging their frustration. I say something like, I know this isn't easy, but let's see what we can do. Or, I know you're not thrilled to be here, but my job is to get you better, and so you can get out of here. I can also use humor to break the ice. I'll say something like, recovery can feel like climbing a mountain in flip-flops, but we'll take it one step at a time. Or, I know this isn't your idea of a good time, but I'm getting paid to be here. I recall one patient who was struggling to come to terms with her condition. By acknowledging her feelings and adding a dash of humor, I was able to help her feel more at ease. I said something like, no one likes being down and out, but let's figure out what we can do to get you up and about. Tailor your treatments to your patient's mood. We all know that a patient's mood can greatly impact their recovery, so I adjust my approach to meet them where they are. I'll say something like, let's take it at your pace today, or I can see you're not in the mood for this, so let's just do what feels right for you today. I also remind them that I'm aware that they have something going on, but still nudge them forward. I'll say something like, sometimes moving can help make things seem a little less lousy, or we're going to try it at your speed today by moving in the right direction. When a patient feels overwhelmed, I acknowledge their emotions, but I try to tailor our session to meet their needs. By doing so, we're able to break through barriers and make some progress with their treatment. I'll say something like, if you're not feeling up to everything today, maybe we can focus on some gentle motion that you can do. Keep calm, carry on. Remaining calm and composed is crucial when dealing with challenging patients. To refocus the conversation and to better understand their needs, I try to use open-ended questions like, what do you want to achieve with our sessions? Let's focus on what you want to achieve out of this. What's your recovery goal for today? We're here to work towards what matters to you. Why are you here? By actively listening to their concerns and responding empathetically, I can transform their frustration into a positive and productive outcome. For instance, I recall one patient who was frustrated with her progress. I said, I hear you're frustrated. Let's channel that into something positive. What can we accomplish together? How to stay polite and courteous with tough patients. It's always important to maintain your composure, to stay poised and remain objective. I make a conscious effort to remain focused and polite and empathetic. To reassure my patients and foster a positive environment, I use phrases like, I'm here to help you reach your goals. I respect your feelings and I'm here to support you in reaching your physio goals. Your recovery is important. Let's work together. I know you've been through a lot to get here. Let's keep moving forward. By being genuine, empathetic, and professional, I can help patients overcome discouragement and stay positive about their recovery. For example, I recall one patient who was feeling frustrated. My response was, I understand how frustrating this must be for you. I know it's not where you want to be. Let's keep moving forward. Ready for the next big section? Hold on to your hats. We've shared strategies for tough cookies, but now it's time to learn to speak the language of patience and creativity for those whose cognitive paths are uniquely paved. And here's where we turn therapy into treasure hunts and stories. You're on a roll, keep it up. Section 3, communication with cognitive impairment patients who need a little extra help. As physios, we see patients with cognitive challenges all the time. This includes children, brain injury patients, dementia patients. These people need a little extra patience, creativity, and understanding to ensure an effective communication and treatment. So how can we overcome communication barriers and provide the best possible care for these patients? Based on my experience, I've developed 4 key strategies for success. Simplified communication. This involves the use of simple language and instructions broken down into steps that are easy to digest and deal with for these cognitively impaired patients. I remember a patient who could not follow instructions if they sounded too complicated. By using simple language and repetition of instructions, these activities were easy to understand and realize the exercise. For example, can you lift your arm? Lift, lift. Push down with your hands and stand up. Push, push up. See this picture? It shows that we're going to move your leg, nice and slow. Can you use your muscles? Push hard, push. Can you stand like a tree on one leg? Using demonstration and repetition, showing patients what to do rather than just telling them can make a huge difference. Repeating instructions to reinforce learning and help them build confidence. Once I had a patient who had trouble balancing on one leg. By showing the exercise and repeating, I helped her to get on that one foot. For example, you can use language like arms up like this, reach for the sky. Can you stand on one leg just like this? Tap your toes on the floor. Can you tap your toes? Tap with me. Tap, tap, tap. See this? Walk heel toe. Walk on a line. Can you walk with me? Heel toe, heel toe. Patience and creativity. Thinking outside the box and making exercises into games or stories can make therapy more enjoyable and interactive. Creative approaches allow patients to remain motivated and focused. For example, let's make this exercise into a game. Each time you stretch, you score a point. Imagine you're a tree growing taller. Reach up to the sky. Can you reach for the sky? We're going on a journey with this walk. Let's explore and see what we can find. Let's squeeze this ball. Every squeeze makes us stronger, like Superman. Finally, family involvement. Family involvement in the process can extend therapy beyond the clinic sessions themselves. This can improve outcomes. I recall having many patients where the families were present during the session. It was easy to extend this patient's exercises into the home instructions and the home exercise program. For example, you can say, can you show your mom your home exercises? Do these exercises at home. Dad can help. Here you go, Mom. These are the home exercises printed out. Remember, no pain, and try these every day. See, your dad can stand on tiptoes. Can you? Let's try it when you get home together. Now let's keep this communication train chugging along by exploring more strategies to help patients who need a little extra assistance. Because when we need to stay on track and not derail from delivering practical tips for clearer communication or better outcomes, bring it on. Section 4, Practical Tips for Physio's Clear Communication for Better Outcomes. As physios, we've all encountered patients with communication barriers. To provide our best possible care, we need to adapt our communication approach. Here are 2 easy yet effective strategies to help you overcome these challenges. Keep it simple. One key idea is to use simple words and phrases. Avoid using complex terminology or jargon that might confuse your patient. During evaluations, I use simple instructions like lift your arm, push my hand, stand on one leg. When doing treatment exercises, I'll say something like lift your leg, start slow, go slow, try hard but no pain, give it some effort but don't push too much. For patient education, I use phrases like stand up, work hard, don't make it worse, move every day. Demonstration with repetition. The second key idea is to demonstrate with repetition. Show your patients what to do and then point to them and use simple gestures. When patients are visually impaired, you can use verbal instructions and tactile feedback to guide them through the exercises. I've had patients who speak no English, so using a translation app and the exercise demonstration, I was able to get through with their communication. I know it might be tough to deal with language or sensory barriers, but with a little creativity and patience, we can overcome these challenges. So next time you're working with a patient who has a communication barrier, try demonstrating the exercise with repetition, simple gestures, and see how this approach improves their understanding and engagement. When I first started as a physio, I thought my job was mainly involved guiding patients through exercises, but I quickly discovered that being a physio is just as much about teaching and communicating as it is about physiotherapy. In fact, effective communication is one of the biggest challenges many physios face, especially when they're working with patients who have unique needs or barriers. But that's the good news. With time, with patience and experience, you'll develop the skills and strategies to overcome these challenges and achieve success. That's why I'm creating these videos, to share my own experiences and insights with you and offer advice and guidance I wish I had when I was starting out. Congratulations, you've unlocked the bonus section. Being a super physio isn't just about treating patients, but it's also about taking care of yourself. Let's explore some strategies to avoid burnout and staying at the top of your game. Keep going, you're almost done. Bonus section, 4 essential strategies for prioritizing your well-being as a physiotherapist. It's essential to prioritize your own well-being, especially in a demanding clinic environment. As the saying goes, you can't pour from an empty cup. To maintain your physical and mental energy and focusing on your own self-care, you'll be a more effective and compassionate caregiver for your patients. Here are 4 strategies to prioritize your well-being. Practice mindfulness with micro breaks. When was the last time you intentionally took a moment to pause and recharge? Not just a brief break to grab a cup of coffee or scroll through your phone, but a deliberate pause to collect your thoughts. Next time you're washing your hands between patients, try this simple yet effective technique. Focus on the sensation of the soap on your skin. Feel the temperature of the water. Dry your hands with intention. This brief pause can be a powerful way to reset and refocus, much like hitting the pause button on a video game. I found this technique to be particularly helpful in stressful days. By taking a few deep breaths and focusing on the sensation of the soap and water, I can calm my mind and let go of that tension. Positive self-talk is your inner cheerleader. We all need a little motivation sometimes. That's where positive self-talk comes in. Tell yourself, I've got this. Be your own cheerleader and boost your confidence. Write down or say affirmations like, I am capable. I am a skilled therapist. This is like programming your mind for success. One time I had a patient who was particularly challenging. By using positive self-talk, I was able to stay focused and motivated. I reminded myself that I was capable and skilled and that I could handle whatever came my way. You're stronger than you think. Stay active. Healthy body, healthy mind. We all know that exercise is good for us, and yet it's hard to fit into our day sometimes. It can be challenging to prioritize your own physical activity. Here are 3 simple suggestions I have for you to stay active. Take the stairs, ditch the elevator, and opt for taking the stairs whenever possible. This is a particularly good way to incorporate some cardio into your busy schedule. Schedule walking breaks. Take short walking breaks between patients or during your lunch. Even 10-15 minutes of walking can make a big difference in your overall activity level. Do some squats or some Kegels during downtime when you're charting or on the phone. Do some squats or Kegels. These simple exercises keep your muscles active and engaged throughout the day. Remember, every little bit counts, and incorporating small amounts of physical activity into your daily routine can have a significant impact on your overall health and well-being. Keep learning, stay curious. Keep being curious. There's always more to learn. I listen to YouTube videos in the car and chat with coworkers and mentors about patients because everyone has something to teach us. I've been where you are, dealing with new research and techniques, but trust me, it's worth it. Staying curious and committed to learning makes you better, makes you more confident as a therapist. Now that you know how to look after yourself, let's apply it. Remember, taking care of yourself is the key to giving your patients the best possible care. From self-care to patient care, the journey continues. You won't believe this, but these strategies make you not just a better therapist, but a more resilient one. So now you're equipped to handle even the most challenging patients. Remember, each patient, no matter how difficult, presents an opportunity for growth and improvement, leading to better outcomes. One more patient story. I recall working with an inpatient who was struggling with depression due to her injuries. Despite her physical limitations, I recognized that her mental state was equally as important. As her physio, my goal was to coach her and see her beyond her current challenges and envision a brighter future. Rather than making promises about specific outcomes, I focused on explaining to her her rehab path and highlighting the progress that she could expect to make. By discussing her potential and the possibilities ahead, I helped her regain hope and motivation. This coaching aspect of our sessions is critical. It's more than just exercise. While patients are doing their exercises, we have a unique opportunity to make a meaningful impact in their lives. By taking the time to connect with them and address their concerns, this empowers them with knowledge that can inspire them to take ownership of their own recovery. In this patient's case, our coaching sessions paid off. She became more engaged in her exercises and was able to improve her functional abilities. Ultimately, she was discharged from inpatient and improved independence. So you've got this. What's been your toughest patient? How did you turn it around? Which technique are you most eager to try here? Share your experiences and stories in the comments below. Now go out there and be confident and be awesome. My 2 books are now available at Amazon. What They Don't Teach You About Documentation in Physiotherapy School, a short how-to manual for successful daily note templates, and From Injury to Recovery Through Exercise, simple functional exercise progressions for physiotherapists to restore lifting, standing, walking. Thank you for your support. Let's go on a journey with this awesome video right here, and subscribe to be among the first to see my future masterpieces. Thank you.